order. Are there any corrections to the minutes of last meeting? Everybody's sitting so far away from me.
It's nothing personal, Mr. Chairman.
Seeing none, the minutes are approved. Let's jump into our agenda, starting with a transfer resolution in the Department of Children and Family Services. Thank you.
Hello. Yep, so we are looking to transfer $32,000 from our maintenance, utilities, and rents that will be underspent to travel and training because we have had, we've realized our field staff should have had some more training, needed some more training, CPR, first aid. Hillbrook, our safe crisis management training, there are a lot of new employees there. We did a supervisory training. With all of our new staff coming in, we had a lot of less experienced staff move up to supervisors and training, so had a lot of extra expenses there in training. We believe our staffing has stabilized at Hillbrook as well as in child welfare, such that we will probably not need as much next year, so we should be good.
Okay, well, that was the one question that I had, so thank you for answering that one already. Anything from the other members?
Nope, I think it's great whenever we could transfer money to training to better professionalize and promote our staff. So.
Yep.
Love investing in our people.
Absolutely correct. No better investment.
How often do you have trainings on things like this in general?
It's kind of as needed. Well, the trainings at Hillbrook, they have a specific training schedule, their annual trainings, but those are planned for on a regular basis. We just had an influx of new employees, specifically at Hillbrook and as well as child welfare. Depends on what the training is, whether it's annual or for a couple years, but kind of that up front with a bunch of new staff at once was what kind of spiked it at one time.
Well, this is great news that you're getting the staff, that we have to train them. It's wonderful.
Yeah, we invested in a lot of new positions this year. Have we been able to fill them all?
We're getting there. I think we have about 6 vacancies in child welfare and about 10 of the front line for Hillbrook. But yep, getting there.
I'll make a motion.
Okay, I have a motion from Legislator McCarron. Do I have a second?
I'll second it.
Legislator Meeker, all in favor?
Aye.
Right.
Motion carries.
Thank you.
Thank you.
Thank you so much.
It's easy.
And now I'm very excited to bring ahead something that's been a big part of my life for the last 8 years. So let's talk about special children's services.
Hello.
Dr.
Thanks for
Anderson
having
and
us.
Jenny Dickens.
So I'm going to mostly turn this over to Jenny Dickinson, who's been our head of special children's services in the health department for 2 years, 2 years now, which comprises early intervention, pre-K, and then a special program, children and youth with special healthcare needs. So Jenny, we prepared some handouts. We only have 15. I hope that that's going to be enough. So Jenny will kind of talk through, obviously answer any questions you have, and Steve Smorrell is here as well and prepared some information on the financial aspects of our program and is here to answer questions as well. This is a big part of our budget line and it's a really important program in the health department, so glad for the chance to be here and talk with you all about it.
I echo that. Hi guys, I'm Jenny. Nice to meet you. I really love this job. I love this program and I'm here for you. So feel free to stop me at any time. Any questions you have about it, I'm happy to answer. So I did a skeleton outline here just to sort of show you a little bit of how we're organized. So I'm a division, Special Children's Services is a division in the health department comprising the 3 programs Dr. Anderson just highlighted. As far as like our staffing, we have myself, program coordinators, education specialists, transportation coordinator, and then public health social work assistants and some clerical staff. The bulk of those staff reside within early intervention. That program is our highest level of staffing. And then we have the transportation coordinator who staffs both programs, transportation for EI and preschool special education. And then 2 of those staff are directed specifically to preschool special ed. So they look and feel like the same programs to families and to the public. So I like to highlight the differences between early intervention and preschool special education.
because a provider in a home for early intervention could be the same provider who's for preschool special education, but there is a distinct difference that I want to highlight. So first, both programs are governed by federal and state law. So I've referenced those there. For early intervention, generally speaking, it's birth to 3. However, some children stay in after age 3 depending on when they can enter preschool. So some children enter in September and some enter in January, so they'll be a little older than 3 sometimes. Primarily, the services in early intervention that you receive are PT, OT, speech, and special instruction. New York State sets the rates for early intervention. We approve the services at the health department for early intervention. And then all of the contracts are also held with the state. We don't hold any contracts for early intervention. For preschool special education, children's age 3 to 5, I apologize for that. And then primarily PT, OT, speech, special instruction, but also any other service that the committee for preschool special education thinks is appropriate for the student's education can also be put into an IEP. And then the chair at each district level approves those services. And then all the contracts are held with Onondaga County for preschool special ed. Children and youth with special health care needs is actually a grant that we have that's not local dollars. And that's children birth to 21. And we provide individual case management, program creation, and we work with other CBOs in the community.
Jenny, can I pause you there for a second? So that was a great introduction. For the sake of folks who don't live and breathe EI and pre-K every day, can you describe briefly what this program looks like so for a family in our community?
Yeah.
How do they get linked up with EI, and what would be the trigger, and then how would this flow for them?
Early intervention, anyone can refer a child for early intervention. So it could be a physician, it could be a parent, it could be a grandparent. So then we contact the parent if it isn't them themselves, and we run them through a registration process, and then one of our staff physically goes out to the home for the intake. That's very important to us. We have a couple key points in early intervention where we require staff to be physically with the family, and that's one. So meeting the family where they are and doing an intake, a needs assessment, and then the next step is a multidisciplinary evaluation, which is contracts that we have with agencies to evaluate a child to see if they qualify for early intervention. So we don't have PTs, OTs, SLPs on staff at the health department. We contract out for those services with agencies. So they're the professionals, they do that work, and then they determine whether you qualify for the program or not. If you do qualify, then we come back in and do an individualized family service plan. And that's where we work on talking with the parent. Okay, you qualify for the program. What are your goals? What are you seeing? What are your needs? And we create a plan that then providers work on for 6 months at a time. And then we check in physically every 6 months, look at the plan, look at the goals, see how the child's progressing. Do they qualify still for early intervention? That's ongoing qualification. And if a child has ongoing qualification all the way to age 3, then it transfers the bulk of the work that we were doing to the school district. So then the school district is responsible for doing another evaluation for now preschool special education. And that's where there is a difference, whereas when we go in for early intervention, it's a family service plan. So we take very much into account the family needs, what the family thinks should be worked on with the child. This is now student-centered, it's student-focused. So the needs are based off what the committee for preschool special education feels this child needs for their education, what would be appropriate for their education. And that's where it feels and looks the same for parents, but can shift a little bit. Yeah.
So at that point, is that where the IEP is formed?
Yeah.
Once they get
100%.
Okay.
Yep. So that's when I'm talking with staff, that difference between in early intervention, it's an IFSP for family, and then the IEP, that family piece is taken out because it's now very education focused.
In the EI stage, are we doing any modifications to the living environment of these people to accommodate PT or OT or anything like that?
So we do have adaptive equipment, and that is something that is more born out of the providers in the home and what they identify might be needed, and then we work with the provider and the family to get that into the home.
Thank you.
I make kids climb in and out of laundry baskets, jump on couch cushions, go up and down the stairs, so there's obviously different levels to this beyond hardcore medical equipment.
Right.
And actually, I was able to take a course years ago that was specific to early intervention, very family, home-centered, where these are all the things that you've got laying around. These are all the great exercises, great activities that you can do with these things. And a lot of counties are, you're actually not allowed to bring toys into the home. The idea being that you want those children to be able to continue to work on the things that they need to work on throughout the week. They're going to accomplish a lot more with mom and dad every day than they are in half an hour with me or with
Hopefully mom and dad are active participants in that. That's the frustration, I imagine.
So that's the nice thing about the IFSP is that it is that family-centered focus where you meet the people where they are and mutually come up with a plan to target all those necessary goals. So I'll jump in when I feel the need.
Yeah, and along those lines, something very, let me plug the Early Childhood Alliance and Help Me Grow. Just last week we started this. The reason we don't, with the toys issues, because if you bring it in, then you're leaving with it, right? So the Early Childhood Alliance has a small grant, and we sent out to providers. They can purchase a toy that they have shipped to the provider. The provider brings it, works with the child and the family with that toy, and then leaves it. So they have some sort of a toy that's geared towards speech, that's geared towards developing fine motor. Now in the home, if the provider was seeing that that home was lacking that. So that's something that just started. I'm really excited about that.
So when the IFSP is complete and they move to the IEP,
Yep.
does that mean that the IFVP is gone completely? There is no more of that?
Yep.
Or is there a?
The IFSP is for early intervention goals, and then that training, not all the time, but some of those goals will transfer to the IEP if that's a goal that the committee deems appropriate for their education.
Okay, thank you.
Yeah, it's a different focus.
And I'd like to point out that these services are all provided at no cost to the family.
Correct.
Throughout the process, throughout early intervention, through preschool. So it's a tremendous good that we do for our community. I think that should be emphasized.
The question over here.
The wait list number,
Sure.
is less according to previous year.
Right now it is.
How do you address that wait list?
So the wait list right now, we don't go by when you are on the wait list. It's like when you get on, it's not a, first, second, third, fourth, because that's not an efficient way to address the wait list, because some of the providers may be seeing a kid one street over and someone pops on the wait list this week that is very close, and we don't want to force them to take someone across the county, because and then that travel time makes it so they won't be able to pick up as many kids off the wait list. So the wait list is very much provider driven by where they are, and then they pick up kids that way. So it's very hard to determine for families how long they're going to be on the wait list. I can tell you that right now I can say with confidence that 20% of our wait list is 6 months or more. So we are able to get services in within the first 6 months for 80% of the families that are coming in off the
Because obviously
MDE.
it's crucial, the earlier you get somebody involved in the program. And I understand that the speech therapy situation is crucial in terms they're just the providers to provide speech therapy to kids at
Yeah.
any age.
That is the one service that the wait list consistently is the biggest for, is speech therapy.
So is there any way to tackle that?
Yeah,
I can give some kudos to your team. So there's a couple ways that they're trying to tackle this. There are some things that we can impact at the county level and some things that we can't. Some things that are set by the state, for example, some of the rates. But some of the things that Jenny's team has been doing to try to get innovative and tackle the waitlist issue in multiple ways. And I'll say that the waitlists are not just a problem for our county, it's a statewide problem and a national issue, unfortunately, because this is a critical program. But some of the things they've been working on are trying to get new providers engaged, introduce them to it, introduce them to the joys of home visiting, especially in the city where we have some of the longer wait lists, to try to come up with means to prioritize people in the wait list, whether it's multiple needs, severe needs, and then coming up with novel ways to help our providers as they're trying to choose who can I pick up, as he's saying, to have mapping. And that was something they developed in-house. So someone could say, okay, well, I know I'm going over to Liverpool, and oh, someone needs services 2 blocks over, I can see them on that day, and to try to increase how many folks can be seen. So they're being as creative as they can within a system that has some stresses right now, to be
also
honest.
taking a look at our paperwork and our processes, because the more that we require of providers to do offline, documenting and so looking at that and saying, okay, what isn't required for the regs that we can loosen up a little bit on, so we've been able to do a little bit of that too. The mapping has been great because when you look at a list on an Excel spreadsheet, it's very different than looking at pinpoints on a physical map and being able to see where the kids are.
I kind of chuckle in one respect and I'm sad in another, in that New York prides itself on being very progressive and ahead of everything, except my feelings when they come to the speech therapy. Many states now have a position that is just below certified speech therapists that can come in and pitch in and help with this problem of service. And we just haven't gotten there yet in New York to put that position in play. It's sad for the kids.
At the state level, they have a coordinating council that makes recommendations. And there are a number of upcoming recommendations, that being one of them, and also being more engaged with pathway programs across New York State for not just speech therapy, but the other disciplines as well. So I'm hoping those get passed and instituted because they would be great.
Now, do you see a jump in numbers when a kid, say 3 years old or 4, gets into a pre-K program at school?
Yeah. So
Outside the family unit,
Yeah.
into the education unit?
not being clinical, but definitely. So there are situations, a couple. So one being, if a child has just been at home and no interaction, especially a first child, it will be the preschool teachers who notice that, okay, this child could use some intervention of some sort that the family didn't really know when the child was home. Also, there are just some things that develop and present as time goes on in the child's age. So we do see a jump in numbers from early intervention total, the kids total in early intervention versus the kids total in preschool special ed.
Does the county have any engagement once a kid gets into the educational situation?
Oversight mainly. So our position at the health department, once they're in preschool special ed, is we go to the committee on preschool special education meetings. So when they're deciding the goals and the plan for the child, we are a participant in that, but we aren't a participant in every single one across every district. So we do tend to focus on the kids who are transitioning from early intervention into preschool special education, the ones that are known to us. And then also reviewing notes before they go in for payment to me, like almost auditing.
And after preschool, no.
After preschool, no, I'm sorry.
So you have such a nice presentation prepared for us, and now I feel like we're kind of bouncing, so I
No,
apologize for
like
hijacking that.
I said in the beginning, I'm here for you,
yeah.
whatever questions you have, I want to answer.
But Ken, we could never begin to address all the different factors at play with this system. But one of the things that I would like to highlight that I do see here is the county will pay for transportation as well. So a lot of families that might be lacking transportation to get to, if they can't get a provider to their home, there are clinics throughout the county that provide these services, and we will physically bus these children at substantial cost. I was surprised the first time I saw it. And I know several years ago, I think we had issues where we had met capacity with some of our vendors on the transportation side. Has that been rectified? Are there any issues on that front?
No, but it's always a topic.
Yeah.
Right, we always worry about it. Luckily, right now, we're able to handle our current capacity, but we talk about that, the transportation coordinator and I. It's hard, the busing companies, it's hard to get drivers, it's hard to keep drivers. So right now, we're good.
Yeah. And another thing, Ken,
Would the parent go with the child, or would they have an aide from the transportation company?
So generally speaking, when in early intervention, if it's parent transport, because we also reimburse, so there's two. If you're going to have services outside of the home, you can either parent transport and we'll reimburse, or you can elect for the county transportation if you can't provide your own transportation. Generally speaking, I would say that when children are receiving services at an agency, the parents aren't as engaged as when they're at home, but that's just the nature of it.
Because it must be more efficient to transport them to a clinic than to send somebody out 15, 18 miles into the county to a home site to do something.
It can be, but also you take into account the needs of the child too, as well as, it's not always a numbers game. Sometimes is facility-based more appropriate for the child? That's something we look at too, not just like the wait list and getting more services in, but sometimes there's a child who could really benefit from that peer-to-peer interaction.
and I was just having this conversation today, but there can be issues with generalizability of skills. So it can be difficult where if a child learns to do something really well in a really specific context with really specific providers, they're not necessarily always able to translate those skills to doing it in the home environment. So it would always be the priority, but with how much work there is to do in this field, it really needs to be all hands on deck. And some kids really thrive in the program setting, I can attest, and some kids benefit from having that parent contact and getting the parents as involved as possible and doing it right in their home environment. And I've walked into homes where that kid knows that they're running the show, and frankly, I'm not going to get anything done until I see them over at the office, and suddenly I'm the boss again. So it's funny how the dynamics come into play with that stuff. Let's see, one thing I did want to ask about, so much of the program kind of exists at other levels. So the implementation is handled here at the county, but we're reliant on, like we said, New York State setting the rates for early intervention, and it all transpires under the federal law. I believe it's been so long now, it's hard to keep track, but within the last few years, New York State passed a rate increase for early intervention services, and my understanding is that that's still held up with CMS. Is that correct?
So there's two, one passed, one is still held up. So there's a 5% overall that's still at CMS, and there's a 4% for underserved that actually did just pass.
Okay, and we talk so much about, especially certain zip codes in our county being such underserved areas. Does that rate modifier, do we know that applies to Syracuse, to certain areas?
I think the approval from CMS for that 4% preceded a clear designation in terms of what is defined as underserved.
Sure.
And that is still in flux for our
Okay.
area. But as you say, we certainly have areas that should qualify as underserved, and
Right.
hopefully it would go.
So in regards to I know that speech pathologists right now the numbers are very low for that profession. Is that a fair statement to make?
Lower than the need.
Okay. I remember, I'll take it back personal, when I was a child, I attended a place called Gabby Services, because is that still,
It has you.
I was gonna mention that. yeah.
Gabby, yeah.
so that's still going?
Yep.
Do some of these, do they go there still?
Yes, Gabby for preschool special education. The only thing with Gabby that's a little bit more difficult is they don't send, it's university, they don't send providers out into the field, so it needs to be someone who can transport up there.
So
Because they don't run programs, we transport to programs, we don't transport to individual half-hour services. So you have to transport for Gabby.
However, the parent would still be reimbursed for the transportation?
Yes, yep, for both programs, for EI and preschool, we reimburse for transportation.
Okay, thank you.
So I think that's such a ripe area of opportunity, partnering with local institutions that have SU with the speech therapy program, now upstate with physical therapy, and I think Lemoyne more recently added a physical therapy program. That's what makes me really excited about our new academic partnership with upstate, is exploring some of these opportunities to meet. You know, maybe this child's not always going to be working with a licensed professional, or maybe they're not working with an SLP, maybe it's the assistant, maybe it's a student, but those things are all happening under the guidance of licensed professionals, and I think we need to do everything that we can to help meet the needs. So it's a really exciting time to explore some of those opportunities.
I agree, and I think along what you were saying, to also encourage and advocate to the state for them to be thinking about these flexible options where you're not compromising care, but you're increasing the workforce in ways that are practical and innovative.
Great,
Another fun thing that we did.
wonderful expenditure of county funds.
It is.
Recently, we started a process by which we can get parent feedback. And that's been really invaluable for the team because it is so overwhelmingly positive. And just for the team, it's not an easy job to be a service coordinator, getting in your car, going from place to place. It's a lot of wear and tear, and then coming back downtown in the parking, and
It's emotionally draining.
Yes, that too,
Right.
physically, emotionally, and to be able every month to pull up new feedback and just show how positive families have been and how much they appreciate the services and they appreciate individual providers. They'll write in there, so I'll get to contact the provider offices and say, hey, you were mentioned. That's just been fantastic over the past 6 months. We've been able to collect that. And as far as I knew, we didn't have that before, so we're really excited about that.
And even as a provider, I really like that you mentioned something that I lose sight of, but this is physical points of contact at various points with these families, with these kids, to see, is this child growing up in a safe environment? Does this kid have access to the things that he or she needs to grow up in a safe and loving home? So I think that's really important.
Yeah.
What one thing would you ask of us as a committee or the county to help you with your program?
Lobby your state officials.
Yeah, I was gonna say, I'm directly, but yeah, 100%. I think that there's a lot of really great ideas that have come from the ground up, and that's with the coordinating council and early intervention, that if we're pushed forward and instituted would be phenomenal. I also know on the preschool side, the rate setting unit for center-based programming is very behind. And that's just every call I'm on, that's such a huge piece of it, that, you start a program and they can't get the rate right away. You have to go off it does have factual basis, but the rate is set in a way where you could operate for a year or two and then owe money at the end because they gave you a higher rate, than you were supposed to as per their rate setting methodology, yes, on the preschool side at the state end. So I think the rate setting unit, as far as preschool for their methodology, and they are actively trying to overhaul that, but things just get caught up time-wise. And so we're having a couple providers who are sort of chafing with the fact that we can't do anything about their center-based rate. It's all at the state level.
regards to the transportation, so I can, if a constituent asks me, they can get reimbursed through mileage?
Yep.
Could they use an Uber service, or?
Currently, we don't have that reimbursement for Uber, but we are working with the Early Childhood Alliance with Lyft. So we'll be able to offer Lyft passes, and we're gonna sort of trial that and see what happens.
So that's something that's currently being worked on now. It's not done yet, but
No, we're just the operationalizing of it and
That-
looking at contracting
sure.
through a sub-agency for a private entity like Lyft and
Sure, 'cause
car seats and all that kind of fun
Yeah,
stuff.
right, because the bus company that's used currently, is that still Lanfear's bus?
Yes, we have Lanfear's, we also have Burn, and then we use Aladdin, not often, but for some of those out-of-county transports. For services that we don't have in county. I don't think we currently have a child who's going out to Rome, but we did at one point, because we didn't have the services they needed in county.
Right. So I think that moving forward, if that LIFT program can come to fruition, it would be beneficial with, like, you spoke, there's issues right now with maintaining bus drivers, maintaining that, to keep it moving, you know, so I think LIFT will be a wonderful piece to when you have an issue with the bus company or whatever, you can just resort to LIFT. It would be wonderful. Okay, thank you.
Yeah.
Was that for ABA in Rome?
I believe, don't make me lie to you,
Okay.
it was Rackers.
Okay.
Just before my.
This was great.
Any other questions?
Thank you very much.
Yeah.
Yes, thank you.
Thanks for the chance
You
to
know
talk
how to
about this.
Get at us.
Yeah,
if you
no,
have
it's
any
always a
questions.
pleasure and appreciate your interest and the opportunity to talk about this. I'll just say, so at the health department, our goal is making sure that every kid in our county, every individual has the same opportunity to live a healthy, productive life. And this program is so at the core of that, by making sure that children who are having developmental delays, who need some extra support to get ready for school at that critical window, are getting it. It's really, really, really important. So glad for the chance to talk about it. And I totally agree. If there's one thing that you could do to help us beyond the chance to kind of talk about it and talk about some of the strengths and some of the challenges right now, is when you get the chance to speak to people at the state, to talk about advocating that where there are areas that we can loosen some of this rigidity and some bureaucracy to get things to flow, to think more creatively about solutions. That is urgently needed for this very important program. Do you agree?
Yeah, absolutely.
I'm happy to hear about less paperwork, so.
The discharge paper. We've loosened up on. And I want you to have a lot of confidence in this program. The team at the health department is phenomenal. All of our agencies are just such great people who at the heart of it want to help these families and serve these families. And then the community agencies that come in and contact me and want to help with LIFT, want to help with making.
Thank you so much.
Thank you so much, Legislator Kelly.
It's fun.
As far as the reimbursements, the state sets
It was
the
pretty
rate.
astounding.
Earlier
So I
intervention.
figured
The
they're
state